Thanks for staying tuned to Channels Television. Welcome to Health Matters. I'm Jome Otaigbe. The song on the lips of many globally is Stop TB in My Lifetime. And so today on the program, we'll be looking at stopping TB, which is an infection that is contagious. Thankfully, globally, the cases are reducing, and of course, we'll be looking at how we can latch onto this in Nigeria, and of course, how you can reduce your risk for tuberculosis infection. I have with me in the studio today the coordinator of Research, Planning and Management at the Nigerian Institute for Medical Research, Yaba, Lagos, Professor Oni Idigbe. Thank you so much for being with us.
Thank you very much.
You're all dressed up in World TB Day T-shirt.
Yes.
Stop TB in My Lifetime.
Yes.
How far have we gone with this?
Well, the fight against TB has been on for a long time, and we're happy. We have some armaments now to really combat TB. We have the diagnostic tools. We have drugs to treat TB. And we are developing surveillance strategies to be able to track TB within urban and rural communities. So the fight is on. TB is curable, but the important thing is to diagnose a case early enough and to be able to treat that person effectively. And that's the only way we can break the chain of transmission. On the 24th of March every year, the world observes the World TB Day. And on each TB Day, World TB Day, there's a slogan, a target for everybody. The TB Day for this, the slogan for this year is Stop TB my Lifetime. It's a challenge to all of us, the young and the old, to put in all efforts we can to ensure that we eradicate TB in our lifetime.
Okay, before we go on talking more about how to stop it, tell us about TB itself.
Well, TB is, let me go to the layman's language. TB is a disease, it's an illness, an infection, which is caused by a germ they call Mycobacterium tuberculosis. They have various types of that germ. They can affect different parts of the body, but the one that is of public health importance, the one that is really very important to us from the point of view of health, is the one that affects the lungs. You know, that is the one you call pulmonary TB. You have other infections they call extrapulmonary TB. The pulmonary TB becomes important because when somebody who has active case sneezes or coughs or yawns, it throws the bacilli into the atmosphere, and anybody that inhales that bacilli gets infected. But not all cases of inhalation of the bacilli lead to active TB. You might inhale the bacilli, it gets into your lungs and settles in your lungs. Once your immune system, your body defense mechanism is intact, it doesn't affect you, just rests in your lungs. And then the aggressive nature of the organism is combated by the body defense mechanism. But as soon as your body defense mechanism is lowered, either by some infection, and then of course the aggressive nature of the organism takes over, and the latent TB develops to active TB. And the person starts throwing out the organism to into the atmosphere, and anybody inhaling it gets infected.
Okay, now let's look at Nigeria. What's the burden of tuberculosis in the country?
Well, there are about 22 countries of the world. Let me start it that way. There are 22 countries of the world that are contributing 80% of the global burden of TB. Some 3 years back, Nigeria used to rank 4th among these 22 high burden countries. But by last year, we moved down to the 10th position, which means we've done a lot to improve our situation. Again,
what have we done?
Well, we've developed a lot of strategies to improve diagnosis. We expanded diagnosing new cases nationally. We've been able to have the government and then other partners have been able to provide adequate supply of drugs to treat those diagnosed cases. Again, in terms of ranking, about 3-4 years ago, Nigeria used to be #1 in Africa. But because of the strategy we have put in place to improve the situation, we have now moved to #4 in Africa. The current infection rate, what you call the incidence or prevalence rate, is about about 115 cases, per 100,000 persons. So we are doing a lot. The government is doing a lot, supported by partners who have the National TB Control Program. They're developing what you call microscopic centers. That is where suspects, people with signs and symptoms of TB, go to be tested, and once they are found positive, they are referred to what you call the DOT centers. DOT stands for Directly Observed Therapy Short Course, and this is the center where they provide drugs for these patients. Diagnosis is free, treatment is free. So people should be encouraged, once they have any signs or symptoms of TB, to go to the nearest microscopic center or primary health care center, or any health facility for that matter, to be diagnosed, and once diagnosed, to go in for treatment.
Okay, now you mentioned signs and symptoms. You've said somebody coughs, somebody who has active TB, then it goes into the air. If your immunity is low, then you can come down with it also. But what are the signs?
Well, the major sign is coughing. If you see somebody coughing for upward of 2 weeks, the person has gone to the clinic or to any health facilities, taking all sorts of drugs, antibiotics, and the person is not improving. After 2 weeks, you should query TB and let the person go for diagnosis. Apart from coughing, the patients, some of them start losing weight, they get weak, there's loss of appetite, and at a very advanced stage, when the person coughs out sputum, the sputum might be blood stained. So these are some of the signs that you get, the general signs, but the major sign is coughing, and at the very acute stage, coughing out of blood.
Okay, and then the diagnosis itself?
The diagnosis is through what we call the microscope. They take the sputum, that is what the patient coughs out. They take a sample from the patient, there's a way they prepare it, and they look at it under the microscope, an instrument they call a microscope. And if you do that, if you're a trained personnel, a laboratory personnel, you'll be able to see the bacilli in that specimen you got from the patient. And by seeing the bacilli, you know that that person has been infected with TB, has active TB. And immediately you diagnose and see that, you refer the patient to the nearest DOT center for the patient to take treatment.
Okay, after diagnosis, a patient is supposed to commence treatment immediately, and one of the very major challenge is the duration of the treatment. You find out that people go for the treatment, then along the way something happens, they can't continue, and then the issue of multi-drug resistant TB sets in.
Well, we have come a long way. Many years back, the duration of treatment of TB used to take about upwards of 12 months. With newer drugs and more potent drugs being discovered, and the treatment duration period dropped to 8 months. But now, there are newer combination of drugs that we are using in this country and have been used in other countries, whereby you can bring down the treatment rate to 6 months, duration treatment. But as I speak with you, there are lots of research and development going on. Newer drugs have been developed, because most of the drugs we're using for TB now were discovered some 20, 30 years ago. So newer drugs have been developed, research and development is going on, and we have the promises, the hope that in no distant future we'll be able to have combinations of drugs that can cure TB in a shorter period of, say, 3 to 4 months. So we've come a long way. With regards to drug intake, patients that have been diagnosed and are placed on drugs should be encouraged, they should be counseled to be adherent to taking their drugs. They should take their drugs every day. And then, on the other hand, the governments and the implementing partners should ensure that these drugs are available. We don't suffer any stock out of drugs, so that the patients don't break their drug intake.
That's another issue, stock out of drugs. People who are on treatment, they go to these DOT centers, sometimes they can't even get the drugs. How do you think the government can work in this area to make sure that treatment is not broken at any time?
Well, we had the problem of stock out of drugs some time ago, but I can assure you that in the past 2 to 3 years, we've not had problems of stock out. Lots of donor partners. We have the Global Fund, We have the USAID, the CDC, the WHO, lots of global international partners have come to support the government to provide these drugs. So for some time, we have not had stock out of drugs. We used to have that in the past. The area you should talk about, the area we should really focus about is those who go to seek care for TB in the private sector. Most of the time, these private sector facilities don't have dots. So when the patients come, they end up prescribing the drugs for the patients. These patients now go to the pharmacy or to the chemist to buy these drugs. These drugs they buy off the counter might be fake. The patients might not have money, and the next time the drugs are finished to continue to buy these drugs, you know. And then these are all areas that contribute to, you know, some of this drug failure. But government is trying now to involve the private sector. The national program is trying to involve the private sector in TB control, especially with TB diagnosis and management. If we can do our best to expand the dot centers to the private facilities, or even getting the private clinics involved, letting the doctors and the care providers in the private health facilities know the correct combination of drugs, the duration of drugs, and how to assist these patients to get good drugs, good quality drugs, and at the same time counsel them to take their drugs regularly. You have to take your drugs every day for the 6 months of treatment.
Okay, let's just go on a quick break, and when we come back, we'll be talking more about some of the centers that people with TB can go for treatment and, of course, preventive measures. To stay with us on Health Matters.
In every society, young people stand in the vanguard of sustained change. Creation, existence, history, and civilization are the very result of an exchange of ideas. The cultural forces, systems, and our very lives depend largely on an active negotiation of our shared realities. Nigeria's present and its future thus depends on her young and vibrant generation. The discourse for that reality begins here.
Join the ongoing conversation on Rubbing Minds every Sunday at 3 p.m. on Channels TV or on channelstv.com. Follow the conversation online on www.yniger.com/rubbing-minds and on Twitter @YNigerTV with the hashtag Rubbing Minds. With your host, Ebuka Obi Uchendu, a YTV production in conjunction with Channels Television.
You're watching Health Matters on Channels Television, and you can join us in this discussion. If you have any comments and a question, you can call us on the number now showing on your screen, or you tweet at us at Yomi_Otaigbe. Right, before we went on break, you were talking about treatment, you know, being like 6 months, and some of the visuals or pictures were showing a family member also monitoring the patient taking the drugs. But sometimes, as I said earlier, this still doesn't work. What are the things that bring about the multi-drug resistant TB?
Well, let me just put it in a simplified way. TB, the primary TB that you get most often is curable. If the curable TB, if you don't manage it effectively with adequate combination of drugs, or that the patient doesn't take the drug religiously, or that the drug provider, the healthcare provider doesn't provide the right combination of drugs, the organism starts getting resistant to these drugs. And there are 4 major drugs you use. There are 2 phases of treatment. You treat with 4 drugs for the first 2 months, and you continue with 2 drugs for the next 4 months. So there are 2 very important drugs that you use for the treatment of TB, the isoniazid and the rifampicin. Once there's a break in drug intake, or you are using the the wrong combination of drugs, the patient is likely to develop resistance. And once it's developed resistance to isoniazid and rifampicin, which are the 2 most potent drugs for the treatment of TB, you classify that patient as having multi-drug resistant TB.
And what's the implication of that?
The implication is that, 1, multi-drug resistant TB is a more serious case of TB. It takes a longer time to cure. It takes more expensive drugs to treat TB. I mean, to treat a case. We call them second-line drugs. What you call susceptible TB, you treat them with first-line drugs.
Okay.
The second-line drugs are expensive. The treatment for multi-drug resistant TB takes about 18 months instead of 6 months.
Longer period.
A longer period.
Let doctor, please hold your thoughts. Let's be joined by this caller. Hello.
Hello, good afternoon.
Thank you so much.
Yeah,
with us.
you're welcome. Yeah, my contribution to the program is to direct my question or my request to the professor online there, that what exactly is going to be done with the number of people that have to be attended to at Yaba. You know, the number of people that are there, in fact, is so discouraging. I was once a tuberculosis patient, which I was treated by one of their nurses there. I haven't seen the number of kills there, and you know, the rate of infection, the possible being infected or get more contacted with the number of people that are there. So what are the programs you have for people that are coming, so that at least we have maximum of people being attended to at a very minimum period? Thank you.
Thank you, Adebayo.
Yes, thank you very much for that question. But perhaps it might interest you to know that apart from Yaba, there are several other centers in Lagos where you can go for treatment. Yaba looks congested because it looks more centralized. There are treatment centers in virtually all parts of Lagos, in Ikeja, in Broad
Where
Street.
exactly?
You know, Broad Street.
Hospital?
You have the General Hospital. You know, you have the Broad Street Hospital. You have the Ikeja General Hospital. Most of these centers, there are lots and lots of dot centers also across the most of the primary healthcare centers. Those centers, provide treatment for TB. There are quite a lot.
Perhaps primary healthcare centers would not be part of it because you hardly will get medication from those areas.
There are specific centers that are designated the dot centers. Drugs are regularly available in these dot centers. I don't have a comprehensive list of all the dot centers in Lagos, but I can assure you there are quite a lot of them. And it's just for people to know that apart from Yaba and all these bigger hospitals, there are also dot centers all over Lagos State.
What about outside Lagos?
Everywhere in the country. You know, they have
to the general hospitals?
At least every local government, each of the 774 local governments of the country, at least each of them have 4 to 5 dot centers. So dot centers are across the country, and it's just for us to educate people, to educate especially people in the communities to know that these facilities are available and to be able to identify where they are. And when they suspect cases, see cases with symptoms, to be able to direct these cases, refer them to these dot centers and the microscopic centers. Microscopic centers are the centers where they go and they test their sputum, look under the microscope to see if they're infected. So my answer to this question would be to advise, that more people should look out more for other centers that are less busy, that they can have faster attention.
Okay, now you were talking about multi-drug resistant TB and
yes,
the implications.
It's quite expensive. The drugs are quite expensive. It takes a longer time. And when the patients are diagnosed, they are treated, in specialized treatment wards, which you call the multi-drug resistant treatment.
Now we really don't want that because
we don't want to go to that level. So we encourage that healthcare providers should provide adequate care to make sure that susceptible TB is fully treated.
Okay, we have another caller. Hello.
Hello, good afternoon, please.
Thank you for joining us.
Yeah, my name is Simala, speaking from Adenogu State.
Thank you.
Please, I have a sister that has this TB and having water in the lungs. They admitted her in the Lute. Then after some, she's there at December in the Lute. Then when she went home, then after the surgery, let after the water comes back, now they don't know what to do in the Lute. They decide that they say she should go home. And she had this tuberculosis and this water in the lungs. And the surgeon tell her to go home. So I want to know what to do, please. And she's at home now suffering.
Okay, thank you, Emmanuel.
Okay.
Well, I think it's not right for them to just discharge and ask her to go home. What I will encourage you is to try another health facility where she'll be given adequate attention. there's still, there's, she can still be treated. There are specialists, chest specialists that can handle the case very easily. But the important thing is going to a facility where they have, competent hands to really, aspirate whatever water she has in the lungs, and then they give her the adequate treatment for TB if they diagnose TB.
Perhaps
so please, she'll be asked to try some other clinic where she will get adequate attention.
Okay, now let's quickly move on to children, because we've not really talked about children. Of course, they also have challenges with tuberculosis.
Yes. Well, yes, TB is in children, it's a serious problem. Serious in the sense that, one, they're very difficult to diagnose, especially diagnosing TB in children, because in the first place, the children, find it difficult to produce sputum or cough. And then the other issue is that most often, once a child is exposed to the mycobacterium, before you know it, it spreads through the entire system. It becomes miliary TB, and the child might not have the classical symptoms that an adult has, and you might think your child is just ill and febrile, and because the classical symptoms are not there, you won't be able to say, okay, this child has TB.
So what can parents look out for?
Yeah, parents should look out for, once the child starts getting so sick, so weak, losing weight, and restless, and high fever, they should take the child to the clinic, a health facility, through the differential diagnosis. The doctor will carry out a sequence of looking out for this is not there, looking out for this is not there. Differential diagnosis, and possibly, with some, we'll be able to come down finally to say this TB. Yes.
Okay. All right. We have another caller. Hello.
Hello. Thank you. Good afternoon.
Thank you for joining us. Please go ahead.
My name. Please, I want to have the moderator, please. From the information from what we heard from you now, you will learn that you have centers where this treatment will be tested and probably a solution could be provided for. But I want to know if all the strategies are available in the local government levels, the grassroots rather. Because most of this information will not seem to get to the grassroots where they need those attention. Please, I want to know your effort.
Thank you, Kazim.
Yes, if you remember, one of the answers to the earlier question that I had was that these DOT centers are available in virtually in all the 774 local government areas of the country, and most of these local government areas are within our communities. But again, that notwithstanding, so the modern trust of TB control is to carry the fight against TB to the communities. So we've started, one of the major thrusts of the Stop TB Partnership is community TB. Take everything back to the communities, train people within the communities on the signs and symptoms. Once they see people that have signs and symptoms, they refer them to the nearest center and they get treatment. A big shift is towards community TB, because we know that within the communities there are lots of cases where, because they are not very, very familiar with the signs and symptoms of TB, and they don't know that TB is curable, they don't know that the treatment of TB is free, they don't know that diagnosis is free, they need to be informed. They need to have massive education. And that's why we have now, advocacy, communication, and social mobilization.
Okay. While we are talking about that quickly, as we wind down, the children do get vaccinated at birth with BCG.
Yeah.
Does this confer lifelong?
It doesn't. It wanes off after some time. That's why the BCG. That's why there are still efforts, current efforts.
But that doesn't say we shouldn't get it now.
You should get it, because as much as possible, to some extent, it protects the child.
For the immunity.
Yes, protects the child at the time the child is young. But as the child is growing, and then growing towards adolescence, the immunity starts waning off.
Prevention.
That is why we're not thinking of globally. They are going towards, developing a vaccine that can confer long life.
So while we wait for the vaccine that can confer long life immunity, quickly, the preventive measures that we can take.
The preventive measures is to look at how TB is transmitted. That is one. You know, one, to have as much cross ventilation, you know, so that you know, people don't stay in a situation where they are exposed to the aerosol and inhale it. Two, one case of TB in a community has the potential of infecting 10 to 12 people. So as soon as we diagnose a case, we send that case to the hospital. Once that case is treated, you have broken the chain of transmission, and that's part of prevention. The next thing is that once you have an index case within a family or a community, try as much as possible to do contact tracing. Try and, all those people that have had contacts with the index case, try and see how you can test them. Talk to them if they have signs and symptoms. These are all efforts that we can put together to prevent.
Okay, and as you've said, don't stay in an enclosed place. Make sure everywhere you stay is as airy as possible, and when we cough, we cover our mouths.
Cover your mouth, yes.
Yeah. Thank you so much for coming on the program.
Thank you.
And thank you all for watching. I'd like to thank Adebayo calling from Lagos, Emmanuel from Ogun State, and also Kazim. Thank you all for being with us. You can catch some of this on our website, www.channelstv.com. I am Yomi Otaigbe. Stay tuned for News Track.